Cardiologist Dr. Fahmi Farah joins us today. Now, she's out of Bentley Heart in the Dallas-Arlington area, and she's here to discuss this as well as warning signs not to ignore. Doctor, thank you so much for your time this morning.
Thank you for having me. It's a pleasure to be here.
Absolutely. So, you know, there's been such a concentration on the coronavirus that other health issues have been going undetected. And this kind of hit home for me this week when I learned that someone close to me has been having some heart issues since last week. And she expressed to me that she's worried about going to an ER because of the coronavirus. And so I had to sit down and have a discussion with her and say, look, you know, that is obviously a huge concern, but the bigger concern is becoming the heart issues, as it has not gotten better for her. And that's something that you're seeing as well, correct?
That is correct, yes. And you brought up a very important discussion that we need to have with our public. So we know that more people are dying during the pandemic than just from COVID. According to the data we have from American Heart Association, there's an excess of 87,000 deaths that happened during just 2-month window of March and April of this pandemic, with a 22% increase in deaths due to other causes. Now, we know that, a study, the JAMA study, showed that there was a huge surge in death due to other causes, particularly cardiovascular disease, especially in states where we're seeing the highest numbers of COVID-19. For example, in New York, there was a 398% rise in heart disease-related deaths during just a 2-month period of March and April, when they saw their peak of COVID-19. And one of the key factors that is delaying care is people being fearful of going to the hospitals. And this is, of course, fear of COVID-19. Mm-hmm. The CDC had also reported that at the end of June, the emergency department visits for heart attack had declined by 23% nationwide. Mm-hmm. And there was also a decline of 20% in the number of stroke visits in the emergency department within the last 5 months of the pandemic. Mm-hmm.
Yeah, it's interesting that you bring that up because, early on, we had saw the numbers, and one of the numbers that I saw was that a nearly 50% drop in the rate of heart attack-associated hospitalizations during the first 5 weeks of the pandemic in the U.S., which to some people on the surface might sound like a good thing, but like you said, the reason why these findings are worrisome is because they suggest that heart attack patients are not seeking that vital medical care that they need. And I know one area that I've at least discussed here on the air of being a concern is cancer patients not being able to get the care that they need during COVID-19 because of surgeries being canceled or being pushed back. But, the instance that I was sharing with you earlier about the person that's close to me, this is a person that's been dealing with chronic pain for like over a year and has needed hip surgery for a while. And because of COVID-19, they haven't been able to get in to see a doctor. And because of that, that pain is just wearing on her. And now she's starting to have these heart issues. And I know that's one thing that you can talk about as well, is that being a factor. People that are dealing with chronic pain and they're not able to address that can cause those heart issues as well.
Yes, and it's not just chronic pain, it's chronic, disease conditions, chronic risk factors. For example, people who have, high blood pressure, high cholesterol, diabetes. These are all chronic conditions. But if they're not able to get that routine, scheduled checkups that they're supposed to by getting in with their doctors and getting in with their cardiologists, then these chronic conditions can lead to heart disease if they're not optimized properly in a timely manner. And that's what we're seeing here. We're seeing, a twofold problem. One is, as a result of the chronic conditions not being handled properly because people are just afraid to come into the doctor's offices. So it's leading to more of an acute issue, which is a heart attack. A heart attack is an acute problem. And so then the second part of the problem is, even in the setting of an acute problem like a heart attack, people are afraid to seek care, and then they're not coming into the hospitals or the emergency departments. And one of the things about heart attack, the reason it's something that we talk about a lot, is because when it comes to a heart attack, time is life. Mm-hmm. It is a time-sensitive matter. So the risk of death actually increases significantly if heart attack patients are not provided the treatment in a timely manner. And so that's the reason why we are seeing an increase in death due to other causes, particularly heart disease causes. So yes, your, the close friend that you're referring to, mm-hmm. And I'm so sorry to hear that, but your sentiment was absolutely right, that if she's in pain and if she has chronic conditions, absolutely, by all means, she should seek care, both from her physician, her primary care physician, and if need be, and if she's having heart issues, she should seek care from her cardiologist. One thing I want to mention, this is in line with the fear that people have of, people have two major fears associated with, going to the hospital. One, of course, they're afraid of the virus itself. Mm-hmm. And two, a lot of people are trying to avoid hospitals because they're afraid that they're going to increase the burden on healthcare providers and hospitals, because they know that a lot of the hospitals are packed with COVID patients. Mm-hmm. So those are the two fears that are primarily driving the, not seeking care and not going to the hospital. And so one of the things I want to say, a really important message, is that the healthcare facilities, both inpatient and outpatient, mm-hmm. have taken very important measures to minimize the risk of spread. They're taking extreme precautions. They're doing a lot of screenings. So the chance of contracting the virus has been really minimized and very much controlled in the healthcare setting. We're actually now more concerned about the spread from the community setting, like grocery stores and places like that, than we are from a healthcare place. So I hope that gives some comfort to our listeners that it is okay to seek care and go to your doctor if it is medically necessary.
Well, and that's what we're going to do here over these next 14 minutes. You'll be coming back for a second segment, and I really appreciate that, because we're going to get into, some of the warning signs not to ignore, because, the conversation we're having right now, it can be a little scary for some, but it's also needed for some as well. And I like that you brought that up, because we've concentrated so much on hospitalizations as it pertains to COVID-19, and there's been, our governor and others have talked about, we don't want to get to capacity. We don't want to get to capacity. And some people feeling like they're doing good, maybe for the greater good, and saying, hey, I don't want to be a burden on the hospitals. And I think I really appreciate you bringing that up, because, we as individuals, we have to make sure that we take care of ourselves, even during a pandemic. And look, I could speak to myself on this with the doctor's appointments. I mean, having that yearly checkup. I haven't done mine yet this year, and it hasn't been top of mind really because of everything that's going on with COVID-19. But even before going to a cardiologist, just going for a regular, yearly checkup for your doctors, that can play a part in not just your overall health, but your heart health as well.
Absolutely. I completely agree with that.
All right, so we are speaking with Dr. Fahmi Farah. She is with Bentley Heart Medical Center in Fort Worth, Texas. And so we're spending some time talking with her. We're going to take this quick commercial break. When we come back, we're going to talk with her about warning signs not to ignore. I also want to ask her about myocarditis with athletes. That's something that came up in the news this week as well. Want to get her thoughts about that. You're listening to the Moon Griffon Show. Brandon Como filling in for Moon. We'll be right back. Welcome back into the Moon Griffon Show. Brandon Como here with you, filling in for Moon, who's out fishing today. Hopefully he gets a chance to really enjoy that. Joining me on the Line 1 hotline is Dr. Fahmi Farah. She is with Bentley Heart Medical Center in Fort Worth, Texas, and we've been having a great discussion about heart attacks and how they have become quite an issue, especially during this COVID-19 pandemic, as unfortunately the concentration going so much on the coronavirus, people taking less concentration on their own heart health, and that is having a very negative impact. Doctor, one thing I wanted to get you to talk about was, can you tell some of our listeners about some of the warning signs that we should not ignore when it comes to our hearts?
Yes, certainly. Some of the classic signs of heart attack are chest pain. Usually it's crushing chest pain is how people describe it. It could be in the middle of the chest or the left side of the chest. A lot of times the pain could be elsewhere as well. It can go down the arm or towards the neck and the jaw area. If you're having these symptoms along with a lot of times people have shortness of breath, profuse sweating, nausea, vomiting. If these symptoms are in the play, then absolutely you need to seek medical care because you could be having a heart attack. Sometimes people don't have chest pain. There are some atypical signs of heart attack as well. It could just be severe indigestion, like symptoms with profuse sweating, nausea, and shortness of breath. That could be an indication for a heart attack as well. That's an indication for seeking help as well.
One thing I wanted to ask you about as it relates to the COVID-19 pandemic, a lot of things that we've been, one term we've been hearing about is MIS-C, and especially as we've talked about it in children. But I was looking up some numbers, and it talked about, from the CDC, it talked about MIS-C patients having severe complications, including cardiac dysfunction. Can you discuss that a little bit, and what... MIS-C, we've heard about it a lot since COVID-19, but, I'm sure it's been a concern before COVID-19 even came into the picture.
You're talking about myocarditis? I'm sorry, you got
MIS-C, the MIS and then the hyphen C, the multi-inflammatory syndrome.
Yes, the multi-system inflammatory syndrome. Yes.
Yes, ma'am.
Yes, so COVID-19, one of the problems we're seeing with COVID-19 is a huge inflammatory surge in the body, in the whole body. Okay. And particularly, it's leading to a problem for the lungs, of course. With a surge, an inflammatory surge, we're seeing the lungs filling up with fluids, basically, and patients can't breathe very well. But it's having an effect on the heart. It is leading to inflammation of the heart in many cases, and it's causing heart failure, basically. So as a result, a lot of patients we're seeing multi-organ failure, like, respiratory failure. One of the biggest concerns is heart failure, and that's leading to other complications like arrhythmia. And that's leading to, a lot of fatalities and, of course, ICU admission and things like that.
Now, one thing I wanted to get your thoughts on, a story that broke this week, talking about myocarditis and how that could actually impact or be a deciding factor for the possible return of college sports and sports college sports and football and such, and talking about how some of the symptoms include chest pain, chest tightness, shortness of breath, and decreased activity tolerance, but having to do with some of the athletes, and how most cases of the disease are mild, but it can turn into something very serious and long term. And it's something that athletes, while they're young and generally are in better shape to fight off COVID-19, unfortunately, there's this discussion about myocarditis, which has more long-term effects than the short-term effects that COVID-19 would have on someone.
Yes. I'm going to address, them in two separate answers, I guess, because we're talking about athletes without COVID and then people with COVID. So yes, we know that, so first of all, myocarditis is a condition where it is an inflammation of the myocardium, which is the muscle, the heart muscle. And this inflammation can happen in athletes. We actually see that often. The cause of the myocarditis in athletes is actually not very well known, but some of the symptoms that they can have, it includes chest pain, shortness of breath, fatigue, activity tolerance level going down. And it can have long-term impact on the athletes. So for example, when people have myocarditis, one of the first restrictions is activity. We want them to be at rest and restrained from, doing vigorous activity like sports. So it affects them in the short run, and in the long run, they can have lasting impact from it. For instance, arrhythmia. A lot of people have arrhythmia as a result of myocarditis. One of the other common things with myocarditis is actually heart failure. So their heart function as a whole can go down with myocarditis, and that can have long-term implications in an athlete's life. Even if they're not to go back to sports, even in their everyday life, this can have huge impact because this subjects them to medications. They can have limitations in terms of what they can do. So yes, it can have long-term effect in an athlete. As far as COVID-19 patients go, this is actually something we're seeing quite frequently in the COVID-19 patients. Even in patients who do not have pre-existing cardiovascular disease, COVID-19 is causing, in many instances, inflammation of the heart muscle, which again is myocarditis. And as a result, their heart function is going down, and they are prone to having arrhythmia, dangerous type of arrhythmia that can cause cardiac arrest.
Doctor, before we let you go, we have about a minute left. What would you like to kind of leave our listeners with, as we talk about making sure that their heart health, that they're checking on their heart health? What is something that you'd like to leave them with, just kind of like a lasting thought?
Sure, yes. I think the most important message here is that, your heart is very important. If your heart is not there, you're not there. And so it's very important to seek help from your physician before it gets to that acute stage. So it is very, very important for you to go to your cardiologist, go to your primary care physician to get regular checkups. And if there is an incident where you feel like you're having a heart attack, definitely do not delay your care. Please seek care in a timely manner. Go to the hospital if it is medically necessary. Dr.
Fahmi Farah, cardiologist with Bentley Heart Medical Center in Fort Worth. I know I threw a lot at you, Doc. I was trying to get everything in that I could in this 30 minutes we had. Thank you so much for all of your information. I really appreciate it.
No problem. Thank you very much for having me.
All right. We'll take this quick commercial break. We'll be right back after this.
Now's the perfect time to enjoy your amazing backyard. Unless you have a mosquito problem, contact the experts at J&J Exterminating and take advantage of $50 off initial service. Make this summer the best ever with J&J Exterminating. J&J